Christopher Irizarry. I'm a candidate for Congressional District 12. For my very first podcast, I would like to introduce a future constituent and colleague of mine, Nathan Sharp. Nathan, welcome.
Thanks, Chris. Thanks for having me on.
No problem. Tell us about yourself.
Sure. So I'm a small business owner. I live in Citrus County in the little town of Crystal River. It's my hometown. My husband and I moved back here in 2020 in the middle of the pandemic to take care of my mom. So we kind of settled here as, her health has various issues. A couple years back, I decided I needed to keep myself busy and I started a small business, Sharp Ideas. So I do political consulting, website work for small businesses, anything in the digital space, that's my wheelhouse. So that's kind of who I am and where I am.
And full disclosure, this is the gentleman who designed our campaign logo. So the state and the star and everything that's Nathan's. I said, he gave me this design. I said, I'd like it. Can I use it? He said, absolutely. So Nathan, you and we've run into each other. We first had a meeting where I spoke. We've run into each other just on the campaign trail. So, getting a call and everything is not unexpected. Last night, you contacted me about something that took place, and you told me about it. So, Nathan, what was it that you called me about?
Sure, absolutely. So, like many Americans, I am on a ACA insurance plan. Some folks call it Obamacare. It's been in the news repeatedly that our premiums and we're going to go up dramatically because Republicans in Congress let the ACA subsidies expire in this latest budget. And I was expecting bad. Right now I'm paying just a little over $200 a month for my premiums, and it I got the email from Blue Cross and Blue Shield. I kind of put it aside for a day or two. I'm just like, I got a lot going on. I know it's going to be bad. I'm not ready for how bad it's going to be, I don't think. So yesterday afternoon, I kind of ripped the Band-Aid off and opened the email. And to my horror, my health insurance premiums went up to $950 per month.
Wow. So that is a $750 increase monthly.
Correct.
And then I did some mechanical wizardry on a calculator. That's an additional $9,000 a year.
Correct. And there's no way I can afford that, Chris. No way.
The number itself, it's shocking, but that amount, what is the impact of that going to be on your life?
Yeah, absolutely. So I'm not going to be able to afford insurance. I've already started talking to my providers about what their self-pay rates are. I've located a firm that, it's called Direct Labs. They do labs for, half the price of what if you would have to pay Quest or, one of the other companies directly. And I'm grateful that I have good providers and relatively simple health concerns that they'll, write me the scripts that they're allowed to, and I don't have to see them 10 times a year to get my prescriptions. One of the other big things is with my plan, I have like $10 mental health care visits. And, I'm a big proponent of therapy and going to therapy. And I'm going to lose my easy access to going to see my therapist every 2 weeks because I can't afford the $400 or $500 that those two visits would cost each month on top of everything else. We're in a mental health crisis in this country, and our Republican lawmakers have just made it that much more difficult for people to get mental health care services that they need with rolling back these credits.
And yeah, we're I know that a lot of people, everybody, you're either receiving some type of mental health benefits and taking advantage of them, or somebody who's doing that. I see a therapist, and I know that gets very, very expensive. I don't know if you've heard this and everything, but our illustrious governor, Ron DeSantis, was recently at a fireside chat where he made a comment regarding people who were you called younger and everything. I have the quote right here. Governor DeSantis said, I think that what we want and what the federal government really won't allow is most people, particularly under 50, what they really need is a catastrophic plan that's affordable, where they can pay whatever they're doing out of the healthcare, out of a health savings account. Most people, outside of paying insurance premiums, are not paying a lot for medical on a routine basis. I mean, I know in the Navy, they told me to take something, I would do it, but other than that, I never did. I
Right.
so that's a statement that our governor just made, but yet you just got the notification that your rates are going up from 200 to 750.
Absolutely. And look, my copay at the primary care with this insurance plan was only $5. Their self-pay rates over $100. Look, the difference in that is just incredible. I go get labs, I have a $10 copay. A standard, CDC, CBC, metabolic panel, all those things, they can run you $500 to $700 if you decide you need to get blood work without having insurance. And unfortunately, our leading Republican candidate for Florida's governor for the next time kind of echoed those statements that people, under a certain age only needed catastrophic coverage, um,
Yes,
which
yes.
is, you know, preventative services prevent catastrophic situations from happening. The fact that I go see my primary care physicians a couple of times a year and I'm seeing some specialists to make sure that, everything is caught before, I have some kind of major illness, not only potentially saves my life, but it saves myself money and it saves insurance companies and hospitals money. It's much cheaper for preventative care than it is for, to treat cancer or any of a bunch of other
Mhm.
illnesses. So the idea that we just need catastrophic coverage is absolutely absurd. They can run you $500 to $700 if you decide you need to get blood work without having insurance. So,
Mhm.
our governor is going down a path that's parallel to the Maha movement. And, he's very all about those things. And this is just another piece of that, right? They believe that, supposed good diets and just exercising, are the panacea for our people that are under 50. And unfortunately, the reality of it is, that's not the case. Everybody needs doctor's appointments and checkups and preventative care to keep bad things from, happening.
Yeah, it's just so shocking and everything. The privilege when I was in the military, that was all paid for. That was all taken care of. So I don't know what it was that when he was in the Navy getting health care that he was paying for. I mean, just these things are outrageous. And for him to say something like, we need catastrophic plan that's affordable. Okay, name one. So it's just it's just such a this is such a tragedy. This is so unnecessary. I'm just going to let you know, Nathan, that for you and your husband and everybody else out there, I've got three things in my platform: health, wealth, and public education. And health, it's a lot of people say it's complicated. It's not. It's just necessary, and we have to do it. And I've lived overseas. I've lived in countries where, universal health care is the norm. It's just so necessary right now, and that's why I'm pushing for this. So Nathan, just real quick, what has your husband said about this? What's going through your minds right now?
It's just worry. It's, what is going to happen next year? At this point, it's so funny that, Chris, that last night actually Blue Cross Blue Shield called me and said, "Hey, we want to talk about your healthcare insurance, your healthcare." And I was blunt with the guy on the phone. I'm just like, until Congress gets their shit together and fixes this problem, I can't renew my policy. So at the moment, I don't have anything to say to you unless you can fix Congress. And the guy just kind of chuckled, and then, we got off the phone. So I mean, it's yeah, I don't know what the path forward is, Chris, but for me, and I think for a lot of Americans, this is going to be a losing issue for Republicans in the midterms. And the more we keep talking about it, the more and we spread awareness. And I think that's one of the reasons I kind of really stepped out of my comfort zone to come on and do this with you, because it's not my comfort zone. Is that we have to keep spreading this awareness about what Republican lawmakers are doing to the American people, especially in this instance.
I appreciate first of all you getting a hold of me, you calling me and everything. Of all the people that you could have called, you called me, and I wanted first of all thank you for that. Thank you for trusting me for this. Second, to let you know that everywhere I go, the number one issue by far is healthcare right now, and that's a message I'm going to take. We'll do what we can to get this fixed and everything, and so you and your husband can sit there and not have to worry about this, and not for everybody that doesn't worry about this and everything. That's the goal. So, look, anyway, thank you for your time.
My pleasure, Chris.
Again, yeah, no problem. Again, your business and everything was get you a unsolicited plug or anything like
Sure,
that for.
sure. Sharp Ideas, and you can find me online at sharpideasllc.com.
Nathan, thank you for this.
My pleasure.
All right, take care, everybody.
Bye.
Call him real quick.
Call has been forwarded to voicemail. The person you're trying to reach is not available. At the tone, please record your message.
Hey, Nathan, again, I just wanted to thank you for that. I think that went extremely well, and I promise you, if there's one thing I could do, it would be this issue and making sure that everybody's got health care out here. I'll be seeing you out there, man. All right, you take care. Bye.